नमस्कार, गुड आफ्टरनून एवरीवन। आज के इस नेशनल वेबिनार अष्टांग आयुर्वेद सीरीज के अगत तंत्र इस सेशन में आप सभी वैद्यों का बहुत बहुत स्वागत है। आयुर्वेद डे के अवसर पर इस अष्टांग आयुर्वेद सीरीज का आयोजन आयुष दर्पण फाउंडेशन द्वारा किया गया है। यहाँ पर उपस्थित पूरे भारतवर्ष से उपस्थित सभी वैद्यों का मैं बहुत बहुत स्वागत करती हूँ। और इस कार्यक्रम का एवं इस वेबिनार का जो प्रारंभ है हम भगवान धन्वंतरी की वंदना से करेंगे। धन्वंतरी वंदना के पश्चात इस प्रोग्राम का आयोजन किस उद्देश्य से किया है इसको भी मैं प्रस्तुत करूंगी। तो सबसे पहले तो हम भगवान धन्वंतरी को वंदन करते हैं।
शंखं चक्रं जलौकां दधतमृतं घटं चारुदौर्भिश्चतुर्भिः सूक्ष्मं स्वच्छातिरुद्यं शुकपरिविलसनं मौलिमम्बोजनेत्रं कालाम्बोद्योज्ज्वलाङ्गं कटितटविलसश्च चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तव निखिलगदमिव प्रौढदावाग्निलीलम्
भगवान धन्वंतरी की वंदना से इस सत्र का आरंभ हमने किया है। तो सबसे पहले सभी उपस्थित वैद्यों का मैं स्वागत करती हूँ। तो धन्वंतरी दिवस पर आयोजित इस अष्टांग आयुर्वेद सीरीज का एक छठा सत्र है अगत तंत्र के ऊपर। अभी तक 5 सेशंस हमारे हुए हैं और यहाँ पर आकर सभी जो विषय है हमारे काय, बालग्रह, उद्भांग, शल्य, अभी ये दृष्टा यानी अगत तंत्र का आज का हमारा सेशन है। इस सेशन के लिए खासकर हमारे साथ उपस्थित है वैद्य महेश सर, वैद्य गोपी कृष्णन सर, वैद्य विष्णु जोगवेकर सर, वैद्य विनोडे सर। इन सभी वैद्यों का मैं स्वागत करती हूँ इस मंच पर आयुष दर्पण के। और काफी अच्छा रिस्पॉन्स मिल रहा है। आज का ये अगत तंत्र का हमारा विषय है। तो इस विषय या इस आज का सत्र जो है इसको मॉडरेट करेंगी वैद्य संगीता देवी, की डेप्यूटी सुपरिटेंडेंट है, साई आयुर्वेद कॉलेज वैराग से है, महाराष्ट्र से। तो उपस्थित सभी वैद्यों का मैं एक बार पुनः स्वागत करती हूँ। और इस अवसर पर आज के दिन एक छोटा सा वीडियो हमने बनाया है। इस वीडियो को भी मैं आपके सामने प्रस्तुत करती हूँ। थोड़ा सा डिस्टर्बेंस साउंड का है। आजादी के अमृत महोत्सव के अंतर्गत राष्ट्रीय आयुर्वेद दिवस पर आयोजित आयुष दर्पण फाउंडेशन द्वारा वैद्य नवीन जोशी, जो कि संस्थापक है इस आयुष दर्पण फाउंडेशन के, मेरे सहयोगी वैद्य अरविंद पाठक, इन सभी की ओर से मैं आप सभी वैद्यों का स्वागत करती हूँ। और अगला कार्यक्रम प्रस्तुत करने हेतु मैं आमंत्रित करती हूँ वैद्य संगीता देशमुख मैम को। यस मैम, अनम्यूट कीजिए।
थैंक यू मैम। गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात्
मैडम आवाज नहीं आ रही, आवाज नहीं आ रही। Ma'am, you are not audible. Dr. Sangeeta.
Ayush Darpan Foundation, Dehradun. On the occasion of National Ayurveda Day, Ayush Darpan has announced various series on Ashtanga Ayurveda. And today, we have motivational and inspiring dignitaries from Agat Tantra faculty. So first of all, I take pleasure to welcome our guest speakers, Vaidya Mahesh P. Savargimat sir and Vaidya Gopi Krishna yes sir. I am blessed to welcome Vaidya Vishnu Jogrekar sir, chairman of session, and Vaidya Atul Ginode sir, co-chairman of this session. I feel happy to welcome our organizing committee, Vaidya Naveen Joshi sir, Vaidya Shilpa Irme ma'am, and Vaidya Arvind Pathak sir. We'll start our session with essence of Ayurveda, true way of healthy living, with the help of the shloka. Samadoshaha, Samagnischa, Samadhatu, Malakriyaha, Prasanna Atmendriya Manaha, Swaste Ityabhitiyate. On Ayurveda, in Ayurveda, perfect health is defined as balance between body, mind, spirit, and social well-being. So today, I request to start our first session. We are here with our first speaker, Dr. Gopi Krishna, yes. Assistant Professor, Department of Agat Tantra, BPSV Ayurved College, Kottakkal. He has completed his UG studies in 2002 and post-graduation in Agat Tantra at TVPM in 2008 and worked as an Assistant Professor in SDM College of Ayurveda Udupi in 2008 to 2012. And now he is working as Assistant Professor in VPSV College, Kottakkal. His topic is Agad Yogas in General Practice. And now I request to accept the honor of Chairman of this session to Vaidya Vishnu P. Jogrekar sir, a well-known personality. I am blessed to introduce you, sir. HOD of Agat Tantra Department, Tirak Ayurved Mahavidyalaya, Pune. He has been honored with editorial board member of various journals. He has published 33 papers, including MD and PhD dissertations. And he is the executive editor of textbook of Agat Tantra ki Pathya Pustak, sponsored by Department of Ayush. Welcome, sir. Warm welcome. And I request to accept the honor of co-chairman to Dr. Ginode sir, Assistant Professor and HOD Department of Agat Tantra, RT Ayurved College, Akola. Welcome, sir. I am honored to welcome you all. And so I request Dr. Gopi Krishna, yes, sir, to proceed with his first session. Topic, Yoga, Agad Yogas in General Practice. Thank you. Over to.
Sorry for the inconvenience, as we started just late. Just first day it is we started late due to some technical issue. So yes. Sorry from my side as an organizer. Thank you.
So I request Dr. Gopi Krishna, yes, sir.
Thank you, madam. Shall I start sharing the screen?
Yes, yes, yes. You can share, sir. You can.
Are the slides visible?
Yes, sir.
Thank you. वागर्था विव संपृक्तौ वागर्थ प्रतिपत्तये जगतः पितरौ वन्दे पार्वती परमेश्वरौ. It is my pleasure to be here on this August occasion to share a few ideas which I have been carrying in my clinical practice for the past 14 years. And today's topic of discussion is Agada Yogas in general practice. Before going to the yogas, let us see what are the possible areas that we can move or that we can put our effort in the general practice. These are a few case photos which I would like to share with you. What are the cases we manage in our hospital OP and IP? This is a case of non-healing ulcer due to a road traffic accident. He had an open reduction and internal fixation, and the skin grafting was done thrice, which was a failure. He had visited to our OP, and we had managed him in the lines of Agada Yogas, and this was the result. And it had healed completely, and this is another case of Pravriddha Amavata. RA was near about 100 with C-reactive proteins near about 70 with multiple ulcers on the lower limb and also maggots. In the first picture you can see maggots. This was the second photo is during the treatment process, and this was during the discharge within 15 days. This is a case of cobra bite. Still the management is going on. This was the condition after the bite. Once he had been to another hospital, the ulcer had formed, and this was on the first day of admission in our hospital. The treatment is still going on, and it is nearly 3 weeks, and this is the condition now. The granulation tissues have developed, the ulcerations have all subsided, pain and his diabetes level also has come down, and this is how the condition is. This is today's picture. This is a case of cellulitis, and within a span of the first visit is the second picture, and the second visit, third picture. This is a case of sudden eruptive clinical condition. He was a diabetic patient with the bronchial asthma, and he had an unknown history of manifestation of this in a day, and we managed with our simple Agada Yogas, and after 1 week. This is a child with atopic dermatitis, with fever, and this is after 4 days. The lesions have almost healed with simple 2 medications that we will discuss. This is a case of pustular psoriasis with a diabetic history in the patient, and this is post Virechana and Agada Yoga as a Rasayana. This is a case of palmoplantar psoriasis, and a senior citizen lady with 72 years history with severe pain, and we had treated in the line of Visha. This is during the second visit, 8th day. This is a case of a Garavisha, to be called as Garavisha, as he is an agriculturist. Post COVID, he started to cultivate, and as a part of cleaning the paddy field, something had brushed over his lower limbs, and this had developed in 2 days. We treated in the line of Agada yogas, and this is the result by 3rd week. He had sent the pictures from his house itself, as OP consultation was not possible as he belonged to another district. This is a case of Luta Visha, confirmed history of Luta Visha, where she had crushed the Luta unknowingly, and this is after 2 weeks. This is again another case of confirmed case of Luta Visha. At night, during his sleep, he had crushed a small spider, and he came on the 3rd day. He was advised a plastic surgery, reconstruction surgery, but by our yogas and management for a month, no plastic surgery was required. It was completely healed. Now let us come to the second part of the presentation, as our time limit is for 45 minutes. Now let us directly move on to the yogas and see how we can effectively use these common yogas. I have cut short the number of yogas and will only tell whichever is available in our areas and what practice we can implement in the cases. First one, Vilvadi Agada or Vilvadi Gutika. As we all know, this reference is from Ashtanga Hridaya, Uttaratantra. Am I audible? Am I audible?
Yes,
Is my
yes,
voice
sir.
clear? Thank you.
Yes.
And this, as we all know, this is a wonderful yoga, and a Nirvisha Agada. I am proposing one more word, Nirvisha Agada, as no Vishadravya is there in it. Right. So we can call this Agada as Nirvisha Agada, and this is what we can interpret through this shloka. With the Vata Kapashamana yoga, it is mentioned that Susukshma Pishtatva is necessary for this. Now, what is the literary meaning of Susukshma Pishtatva is practically debatable, because as far as the Pishta or Bhavana is concerned, the finer the Bhavana, the finer the drugs, the finer the result, more penetration and more effective the yoga will be. Another reason for Susukshma Pishtatva is, as we all know, the mode of usage of Bilvadi Agada is Anjana, Pana, Nasya and Lepa. So if there are any of coarse powder material in it, a practical difficulty is there while doing Anjana and Nasya. Pana, it's okay. If we have a coarse powder, we can swallow. But Anjana and Nasya, the drug needs to be very Susukshma Pishta. That is also a practical aspect for being this word. And the indications are also very, very characteristic that we can note in this is, there are 2 lines of indication here, right? Bhujanga Lutonduru Vrishchika Dehi Visuchika Jirnagaradvaraishcha Arthan Naran Bhuta Vidharshitamshcha Swasti Karotyanjanapananasyehi. What I would like to convey in these 2 lines, there are 4 specialization practices that we can implement this yoga very effectively. First is for us, Bhujangaloton Vrishchika Dehi, in the conditions of bites and stings, and wherever there is a toxicological condition and interest in it. Second, phrase is Visuchika Ajirnagara Jwaraischa for the Kaya Chikitsa practice, where Charaka in his Vimanasthana mentions Ama Visha when the Ama is present in the body for a considerable duration without getting digested or without getting expelled in a methodical way. So in this sense, Ama is considered as Ama Visha, and in the lines of Grahani also, Ghoram Anna Visham Chatat is another cross reference that is available in Charaka Chikitsa Sthana Grahani Chikitsa Adhyaya. Wherever we need a potent Amahara property in our prescription, drug of choice will be Bilwadi Gutika. Visuchika, Ajirana, Gara, Jwara, all these are again, if we consider these features in a spectral disorder, Visuchika is there in Visha, is there in Dushi Visha condition, is there in Gara Visha condition. Ajirna is a prodromal or premonitory symptom before the toxin starts its action in the body. And Jwara, as we all know, Rogarat, it's a spectrum disorder, and the relevance of Jwara and Visha is very evident in Charaka Chikitsa Sthana, where he mentions about Abhishangaja Jwara, where he mentions Abhishangaja is definitely because of Visha. And another context where he mentions Jwara and Visha are in the conditions of Punaravartaka Jwara, where we have a lot of contributions to make in the lines of Agada Tantra. If we see Charaka Chikitsa Sthana 3rd chapter, in the reference of Punaravartaka Jwara, we can see there the manifestations of skin, the manifestations of joint, and also immune compromised condition where a patient can land up, that too in the context of Dushi Visha. Next, Artanaran Bhuta Vidarshitamscha is for Manasaroga and Kaumarabhritya, where Bilvadiguti is a very good choice for Pradhamananasya in the cases of Kapha Utlishta Avastha, in the case of Unmada, Kapha Utlishtatva in the conditions of depressive disorders. And one textual cross reference that is available in Charaka Chikitsa Sthana 9th chapter, if we go through the Nidana, he mentions Gara as one of the Nidana for Unmada. So it is our duty to take the history meticulously without leaving a single small point, even from the point of patient's point of view, as well as if at all we need to get clarification, bystanders are also to be properly asked to get a proper history. So once we are establishing the involvement of food and Manoroga together, Charaka Chikitsa Sthana 9th chapter, where he mentions Nidana for Unmada, if you see, Viruddha Dushta Shuchi Bhojanani is the first line, where he mentions Dushta as the Chakrapani quotes. Dushta word is Atyantam Kalushau Garadau. Atyantam Kalusham Garadau is the word Chakrapani mentions. So there also lies the relevance of Manas, the relevance of food, and the relevance of Gara. And next, for Kaumarabhritya, where Bilwadi Gutika is an excellent choice in autistic spectral disorders. We have been trying the Bilwadi Gutika in a sustained small dose for a long duration, where the children's in autism there will be a little bit agitated behavior. Such behavior has come down where Bilwadi Gutika has been given in a smaller dose for a longer duration. So what we can interpret in those two lines is a much bigger dimension. And if at all time permits, in some other context, we can discuss in the specific situations of autism, specific situations of Unmada, because we have tried with the help of Manasaroga department in our college with the Pradhamananasya of Bilwadi Gutika and Churnanasya and Swarasanasya, Kalka to be precise, we can call, with the Bilwadi Gutika and Tulasi Swarasa were mixed together. It was made into a potali, and its Kalka was squeezed for Nasya. In such Kapha Prakupita Avastha, depressive state of condition, we had got a very encouraging results. All the mode of usage, Anjana, Pana, Nasya, Lepa, we have been using. So it is a very effective yoga. So kindly, once those indications come in front of us, it is our duty to interpret this yoga in a newer dimension. Anupana is also very, very specific, where Tulasi Swarasa, we can use this in the case of Jvara, in the case of Visha. Ardraka Swarasa, in the case of Visuchika Jirnagara Jvareshcha. Jiraka Jala, in the case of Kapha and Vata going together, and Pakvashaya is the site in the case of Dushi Visha. And if we see the indications and the treatment for Dushi Visha in Pakvashaya, almost Jiraka like Prakshepakas will be very handy. And Madhu is another drug. It can be used in the context of hepatic disorders also. This is the second yoga, Vishavilwadi Agada. This is from Kriya Kaumudi, another textbook of Vishajikitsa in Malayalam, where the yoga is very similar to Vilwadi Agada, where Nilini Mula, Ishwara Mula, and Patha are additional drugs, and it is having an enhanced action. Whatever we had discussed in the context of Vilwadi Gutika, it has an enhanced action, and we use this Vishavilwadi Gutika in our OP, and in that snake bite ulcer case, as well as in the case of that road traffic accident and that skin grafting case, we had used this Vishavilwadi Gutika together with Jiva Raksha Gutika. It is another yoga that we won't discuss today, because the number of yogas are, we have to cover a lot. Nilini, Ishwara, and Patha are definitely enhancing all these results as far as such ulcers are concerned, where Kapha and Vata are predominant in the clinical condition. And one more reference that we can get is adding Ashwagandha to it. That also we are having in our hand, and we have been using it in the case of Bilwadi Gutika prescribing as a Rasayana Yoga, and another is Gorochana, and that too we are having, and we have been trying this condition in the skin as well as respiratory condition going together hand in hand, and also we are using it in the conditions of atopic dermatitis, and wherever we are facing a difficulty how to choose the drug. If we give for respiratory system, the skin may get deteriorated, and if we try to prescribe in the skin disorders, the respiratory condition may get deteriorated. So a compensatory mechanism has been working in this combination, where Bilwadi Gutika with Nilini, Ishwaramula, Patha, Ashwagandha, and Gorochana. This is very specifically indicated in the conditions where we get a special scenario, as I explained now. This is another yoga, Murvadi Agada, where this is from Ashtanga Hridaya, Uttaratantra, in the context of Gara. If we see this yoga, Murvamrata Natakana Patola Chavi Chitrakan, Vacha Musta Vidangani, now the Prakshepaka comes. Takra Koshnambu Mastubihi. Takra Koshnambu Mastubihi. Pibed Rasenava Amlena Garopahata Pavakaha. Indication is nothing. We won't get any indication from this. Garopahata Pavakaha. For this, we have to dissect what Gara means clinically. How a patient of Gara comes to the OP, comes to our IP, and what are the things we have to consider when we consider the case as Gara. So wherever there is Gara, theoretical explanation, we will discuss in some other context. Gara Upahata Pavakaha is a very broad indication, where the condition like alcoholic liver disease, non-alcoholic liver disease, or immunological conditions like Addison's disease, Murvadi Agada has been tried. In the conditions where neurodegenerative conditions where we need to give an Agni enhancing drug, Murvadi has been tried. In such conditions where hepatobiliary system or GIT or neurological cases are concerned, a step ahead than whatever we get an Amapachana in other those concerned context, Murvadi stands ahead. For example, Shadharana, we can compare Murvadi Agada with Shadharana, but Murvadi Churna stands apart. Its action is very good, and specifically if we practice with the Tatra or Ushna Jala, the action will be more, because the text says so and we are bound to follow that. Murva, one more clinical condition that we can use Murvadi Agada is Pakvashaya related conditions, where Vaishwanara Churna is a choice for this. Vaishwanara Churna is a very good Anulomana drug, but it is very Tikshna. But Murvadi is also a stomach or intestine friendly drug, where Tikta Rasa dominates in this. So the patient will also not have much burning sensation if we prescribe Murvadi Churna or Murvadi Agada. Nirvishagada with Kaphavata Shamana, Garopahata Pavakaha is the general indication, but the area is very big. Gara, if we see the shloka of Gara, Pandu, Krisha, Alpagni, Kasa, Shwasa, Jwararditaha, Vayuna, Pratilomena, Udavarta is the condition. Swapna Chinta Parayanaha, again Unmada spectrum, Mahodara, Yakrit Pliho, alcoholic liver disease or non-alcoholic liver disease, or even liver parenchymal disease. We have also tried with the liver parenchymal disease and also renal parenchymal disease with the Amapachana. The first prescription was Murvadi Churna added together with the Nimbatvagadi Kashaya. Nimbatvagadi Kashaya is another yoga mentioned in Kamala, in Sahasra Yoga. But Murvadi was the Pachana Dravya used for those clinical condition. Anupana is Takra, Ushna Jala, or as per the clinical condition. When to stop? Now every clinician has a doubt when to stop the medicine and change the prescription. When we feel like the ama has been properly dealt with, the Pachana has occurred, we can stop and start the second line of drugs. This is another important yoga, Dushi Vishari Agada. Dushi Vishari Agada, as we all know, the name suggests Dushi Visha. Again, it is a Nirvisha Agada with the Kaphavata Shamana in nature, a Rasayana Yoga as well as Shamana Yoga. In all the clinical condition diagnosed as the one due to Dushi Visha. Again, there is no diagnosis of Dushi Visha. Just like Gara Visha, we cannot diagnose a patient as Gara, a patient as Dushi. There can only be clinical condition which are due to Gara or which are due to Dushi Visha. The symptoms which are mentioned in those respective conditions can be the presenting symptoms in front of us. What I mean to say is, a patient with ascites can be brought under the umbrella of Dushi Visha or Gara Visha. A patient coming to us with multiple system failure and who is left off from other hospitals the cases to bring. If the history is mistaken, now the probability of adding those condition or bringing those clinical condition into the perspective of Agada will be very difficult. And Anupana, Madhu and Dadi, when to prescribe? This is very important question again. If we see the textbook, we see Dushi Visharto Susvinnam Urdhumcha Adhascha Shoditam Dushi Vishari Magadam Lehayet Madhuna Plutam. Text is always right. So always opt Dushi Vishari Gutika or Dushi Vishari Agada post Virechana in the form of Rasayana. That will be very ideal placement of Dushi Vishari Agada. may it be skin, may it be a GIT condition, may it be a joint disorder. Wherever we get an autoimmune condition, which we can place it into the area of Dushi Visha, we have to do Shodhana first and then prescribe Dushi Visharyagada as a Rasayana. Dashanga Gutika. Dashanga Gutika is mentioned in the Kita Visha context of Ashtanga Hridaya. Yoga is available. Every yoga which we have been discussing is available in market. Dashangam Gutika is a little bit different yoga than we have been discussing, because Kita Visham Jayet is the indication of Dashanga Gutika. So where we can place? It is Kita Visha Prakarana, that to Dushi Visha Kita. So what is the difference between Dushi Visha and Dushi Visha Kita? The presentation mentioned in the textbook while mentioning about Dushi Visha Kita is a delayed response or an acute on chronic clinical condition, a dermatological manifestation or a joint disorder where we need an emergency management because the condition is very chronic, but because of some other factors where the patient had exposure for the Nidana again and the condition is deteriorating or it has recurred. In such conditions, Dashanga Gutika is a very good choice. And there is a very good option for us to use Dashanga Gutika together with the Bilwadi Gutika in urticaria or in vesiculobullous lesions or in Ashaya Apakarsha Samprapti, where Charaka Sutrasthana 17th chapter he mentions Prakritistam yada pittam marutah shleshmanakshaye sthanadadaya gatreshu yatra yatra visarpati tada bhedascha dahascha tatra tatra anavasthitaha Gatradeshe Bhavatyasya Shramo Daurbalyamevacha is a reference mentioned in the context of Ashaya Pakarsha Samprapti. I will place that word Samprapti together with Ashaya Pakarsha because it is not a diagnosis. It can be a clinical condition. If not treated in that time, the patient may probably land up in another disorder. That is why vesiculobullous lesion, or in the cases of urticaria or the Kita Visha proper, we know it's a case of sting due to some insect. Now we can opt Bilwadi and Dashangam together. And while managing this bites and stings, better to use Bilwadi externally and Bilwadi and do this Dashangagada internally. Anupana, as per the clinical condition. We have even used Karanja Patra Swarasa for enhanced action for Dashangagada in the required clinical condition, Karanja Patra Swarasa. It is very effective. Now comes the role of Punaravartaka Jwarahara Kashaya. If you interpret this shloka, this is in the context of Jwara Chikitsa of Charaka Samhita, where we already discussed about the relevance of Jwara, the relevance of Visha, and the relevance of Rasayana, and the relevance of Ojas in the context of the management of Visha in Jwara. The exact placement of Punaravartaka Jwarahara Kashaya is that child, where that child we had discussed, right? Atopic dermatitis. And together with that, we need a Pachana, we need a Virechana, we need Tiktarasa, where Tiktarasa, it is worth noting that in Sutrasthana of Charaka Samhita, Tiktarasa is mentioned as Vishagna. Tiktarasa is having a Vishagna property also. The drug is Tikta, the drug is Pachana, the drug is Laghu, the drug is Virechana, and if we see the ingredients, it is also very, very effective and directly correlated to a dermatological manifestation, because Guduchi is there, Parpataka is there, Kiratatikta is there, Katukurohan is there, Musta is a very good Pachana, and others are Tikta Virechana in nature. So wherever Kleda Pradhana Avastha is there in a condition, and we need Virechana, and the patient should not fall into the Vata Prakupita condition, we can prescribe this Punaravartaka Jwarahara Kashaya as a Kleda Shoshana Virechana option. Swalpena Pyapacharena Tasya Vyavartate Punaha is the word mentioned in Chikitsasthana, 3rd chapter, Jwara Chikitsa, 334 shloka. This is the shloka of Punaravartaka Jwara concept. Ojo Vaishamya and Punaravartakatva is the concept. Isn't this two words relevant in Dushi Visha? It is. Definitely it is. Because Swalpena, Api, Apacharena, the patient may land up in the same clinical condition which he has been suffering from the past n number of days or months or years. So this is the relation to the repetitive clinical condition, its manifestation in a patient, and we can bank upon Punaravartaka Jwarahara Kashaya. It is relevance in skin, joint, respiratory and other recurring conditions. It's a Pitta Virechana Yoga, Pachana, Anulomana, and more important, it is Kleda Shoshana in nature. So in such conditions where we need Kleda Shoshana, we can opt Punaravartaka Jwarahara Kashaya. This is another yoga where a Malayalam yoga. The reference is from Prayoga Samuchayam. Amukura Vayambadi Kashayam. Amukuram is Ashwagandha, Vayamba is Vacha. So Ashwagandha Vacha Adi Kashaya. Ashwagandha, Vacha, Chandana, Katukurohini, Trikatu, Ishwara Mula, and Jiraka is the Prakshepaka Dravya. So the time of intake on the right side, fourth point, red, time of intake is very characteristic, evening. So it is an indication for us. It has to be taken in Vata predominant condition, Vata predominant condition, and it is very effective in the cases of chronic skin and joint disorders. Chronic skin and joint disorders where Vata is the major factor in the manifestation of the condition. So we have been trying this Amukura Vayambadi, and another yoga is there, Neeli Karanjadi. Neeli Karanjadi, it is not the discussion point of today because no photo of Neeli Karanjadi yoga prescribed is there. So Amukura Vayambadi Kashayam was given in all those ulceration condition in that Magod's case where the lady had Jwara as the predominant feature and she had multiple ulcers. The case was Amavastha in nature, and we could not give Virechana in the first hand prescription because her RA factor was more than 100 and her C-reactive protein was near to 70 and ESR also 100 crossed. So in such condition, it will be a mistake from my side if I think of prescribing a Virechana yoga in the initial prescription. So we opted a Pachana yoga, which helps to manage in a chronic clinical condition, and an Amapachana yoga is necessary and it should be in the context of Visha. Ashwagandha Vachadi Kashaya will be ideal. Katukurohini, Trikatu, Ishwara Mula and Jiraka. So Sarva Visha is the indication. Sarva Visha means it can be prescribed in Vata Rakta also. Vata predominant, Vata Adhika Vata Rakta is one of the ingredients because we all know in Charaka Samhita, there is a reference, Akhoho Vishameva Kruddham. Akhoho Vishameva Kruddham is the pain description that we get in the context of Vata Rakta. Akho is, we know, right? The pain, how the patient will be having pain predominant clinical condition in the case of Mushika Visha. This is also a very good option in such Vata predominant condition. Kottam Tagaradi Kashayam. Kottam is Kushta, Tagara is Tagara. Kottam Tagaradi Kashayam, or it's Panajala. Panajala is also another indication for this. Yashti, Tagara, Kushta, Chandana, Ushira, and Sariva. These are the 6 ingredients. It is from Prayoga Samuchayam. It is a Pitta Shamana Yoga and Shodhara Yoga. If you remember that road traffic accident, this was given for Panajala. Panajala, if Pitta is predominant in the condition, the clinical condition is Vata Pittottara. The clinical condition is Tikshna Swabhava Yukta and Ruksha in nature. We can opt Panajala instead of Kashaya because it is not Agni Siddha. The Panajala, in the sense, the Kalka of all these drugs should just be dissolved in 1 glass of water. Half a teaspoon of Sukshma Churna of this yoga is to be dissolved in a glass of water and it has to be taken in Muhurmuhu. No Agni Samsparsha or Agni processing is there in it. So that much Pitta Shamanatva we can expect in this. So why Kushta is there in this will be a question. Kushta is Vata Kabhara, Tikshna, and this is a Vishagna Dravya. Kushta is a very good Vishagna Dravya. Together with that, Gandha Dravya is very necessary in managing Vata predominant conditions where the condition is Tikshna Swabhava Yukta. The clinical condition, I mean that the clinical condition should be Tikshna in nature. That is why deliberately this yoga is being practiced in Mandali Visha, and it is placed in Mandali Visha Chikitsa Prakarana also. The mode of usage is varied. We use for Kshalana, we use for internal administration, we use this for Panajala as well as for Kashaya. Ulcers and suppurative conditions also. In the case of gangrenous conditions also, we have been using it for external application. In Jwara Samprapti, where atopic dermatitis, it can be used for Panajala. Simply, we need to put 1 teaspoon of this powder in a liter of water, and that 1 liter of water is to be finished in a day. That even has an effective role to play in controlling the pitta, and it is a very repeated yoga 3 times in 3 different contexts. The same yoga is mentioned in that Prayoga Samuchayam textbook in 3 different mode of usage. That shows the significance of this yoga in Visha Samprapti. Next is Musta Ramachari Kashaya. Musta, we all know, Ramacha is Ushira. Musta, Ushira, Shunti, Jiraka is mentioned twice in that yoga. So we have to take 2 parts of Jiraka with Kiratadikta, Nimbatvak, Chantana, Kumari, and bolded Ishwaramola and Sarpagandha, Ashwagandha, Ribera, and Trikatu. Ashwagandha as a Rasayana, Ishwaramola and Sarpagandha are significantly necessary in the case of psoriasis where the stress is a factor. If you see the last word, stress associated conditions, we have found a very encouraging result in the cases of psoriasis, in the cases of psoriatic arthropathy, where stress has played a major role in the waxing and waning of symptoms. Wherever there is aggravation in the conditions of stress, now we can prescribe this Musta Ramachadi Kashaya together with Dashangam Agadam, Dashanga Gutika. We have a very handy yoga in this form, and we think of Takradara, IP, or stress relieving medicines. No, not necessary. We can comfortably use this yoga for 2 or 3 weeks, and we can see the patient telling the result. Vata Kapha Shamana Yoga, where cellulitis and febrile conditions have also a role in this. Shleshma is one of the words mentioned here. Here, Shleshma signifies Shaitya, not Kleda Pradhana, but the Shita Swabhava of the disease is to be considered here. Shleshma, Virayam means a condition of febrile condition is the translated terminology for Virayam. In Malayalam, Vira is febrile condition, and Shleshma predominant condition where Shaitya is there in the patient, and we need to get an Ushna Yoga where stress is also to be managed. We can consider Musta Ramachari Kashaya. Lodra Sevyadi Kashaya, we all know, mentioned in the context of Luta Visha, where Kleda Pradhana is the condition we can manage. So pemphigus and pemphigoid lesion, where Visarpa and pus predominant conditions are all where we can prescribe a Shamana Yoga, where Punaravartaka Jwarahara Kashaya is not our choice. Lodra Sevyadi Kashaya comes to the action. Next is Nalpamaram. Nalpamaram means Vata, Udumbara, Ashwata, and Plaksha. Nalpamaram is Vata, Udumbara, Ashwata, and Plaksha. Nalpamaradi is another yoga where these are the other ingredients. I will share the slide. The indications of Pitta, Kapha, Shamana Yoga, Vishaja, Visarpa. Vishaja, Visarpa is the indication. Internally, we prescribe this, and I have been using this Nalpamaram Kashayam for internal administration in the condition of avascular necrosis of hip, where we need a proper Dhatu Poshana Nyaya is to be set right. Dhatu Poshana Nyaya, we all know, right? Khale Kapoda Nyaya or Kedara Gulya. This a transformation phase of Dhatu, where one Dhatu to the next Dhatu, subsequent Dhatu, is to be properly formed, or else there can be a clinical condition in front of us with the inverted comma Dhatu Pradosha Javikara, especially Meda asti, majja. These three areas, the dhatu poshana krama, if we need to be very particular, Nalpamaram is a very good choice internally. We can prescribe this in Kshirapaka also. And infective granuloma conditions and folliculitis also, we have been effectively using this Kashaya. Swelling and pain, these are the common yogas that we use. Shigru Punarnavadi Lepa. Shigru Punarnavadi, I think all are familiar with this yoga. Shigru, Punarnava, Haridra, Vacha, Chandana, Patha, Ishwaramula, Yashti, Shirisha, and Gokshura. This is used for external application. Arkapatra Sweda. Arkapatra is to be prepared in the form of potali, and it is to be heated with the help of an iron pan by smearing grita in that, and that Sweda is to be kept over the pain site. This is mentioned in the context of Visha, Samanya Visha Prakarana Chikitsa, as well as in Darvikara and Nimba Nili Karanja, Nimbatvak, Nilini Panchanga, and Karanjatvak. This is also very effective in the management of Vatarakta. And Erithaila is probably time is running short. We will discuss in some other context. And Grita Saindava Parisheka, another effective yoga. Simple, Grita liquefied and put Saindava to it and do Parisheka. Repeatedly do Parisheka. Swelling and pain will subside. If Grita seems to be costly, think of Arkapatra Sweda, cheaply available, and Dattura Phala and Saindava Lepa. Dattura Phala, the phala should be opened, its half of its seed should be removed, add Saindava Lavana, and it is to be swedita, properly swedita with the kshira, and then the kalka of this is prepared and used for application. This is another very good yoga, Parantyadi Taila. If time permits, we will discuss in some other condition. It is mentioned in Mandali Visha Prakarana. This Taila, we are using this, including that some few controversial or confusing drugs are there. I have mentioned it. You can take a photograph of it, or I will give this slide to the organizers. No doubt in it. This yoga is also available. We are using this in that cobra bite ulcer. Presently, he is being treated with the Parantyadi Taila external application. After this, the granulation tissue has very fastly developing in him. Once that pus and slough has been removed, we are using Parantyadi Taila. If vomiting, Bhumya Malaka Prayoga, Kalka is to be used externally to be anointed over the neck, vomiting will subside. And the second yoga is easily practicable for small children also. Dhanyaka, Bilva Mula, Jiraka are to be heated, dry heated, and tender coconut water should be poured to it. And after 1 hour, it should be squeezed well and filtered properly. And Sita is to be added as Prakshepaka Dravya, and then it is to be given Muhur Muhur. This is the yoga that I always trust when there is chardi in the patient because of some food poisoning or krimi. Krimi is another very big area to be discussed, and the relation with krimi and visha in some other context. Urine retention, again in the conditions of hematuria or urine retention condition where we diagnose the case as Mutra Krichra, Kushmanda Kanda, Kushmanda stem is to be taken, its Chaturthavashesha Kashaya is to be prepared, Ela and Sita also can be added, Ela as Prakshepaka Dravya, and it is taken in Muhur Muhur dose. In the management of Mandali Visha or in the management of cobra bite, where there is a patient complaints of urine retention, this is the commonly prescribed yoga. Second is Pippali Ela and tender coconut water. This is also practiced. Both are very effective in the conditions of hematuria and the retention of urine. In the conditions of bleeding, Lajjalu Kshirapaka is one yoga, and Shatavari Kanda Kashaya with Madhu, and Kshirena, Kshiri Vrikshanam Kashayam Sasitam Kanam, Prayoga Samuchayam reference. We have been using this in such bleeding conditions. These are the formulations that we use: Taruna Bhaskaragada, Jiva Rakshagada, Dushi Vishari Gutika. Dushi Vishari, 3 variants are there, all look alike: Murvadi Gutika, Pilvadi, and Visha Pilvadi, Pavitra Vatakam, and Erithaila. So finally, before concluding, this is what we have Anantaparam Kila Shabda Shastram. Shabda Shastra is very big. Our science is very huge, vast, and our ayus is very less. And Vigna is unlimited. There are always a lot of distractions in our life. Grahyam tata param apasya palguhu. Instead of all these barriers that we have, challenges we have in our life, Grahyam tata param apasya palguhu. Hamsam yatha kshiramivambal madhyat. Let us be the Hamsa, taking the milk out of the combination of milk and water. Let us take the best possible things from the science and practice to the perfection. So I conclude here and over to the organizers. Thank you.
Thank you, sir. Thank you very much.
Ma'am, continue with
audible?
questions. There are many questions. Yes, continue.
Yes, sir. So
Take
I
questions.
request before question session, madam, before question
answers.
session, I request
Question answers
Dr.
लीजिए मैम.
Vishnu.
क्वेश्चन आंसर डिस्कस करेंगे पहले. चैट बॉक्स में काफी सारे क्वेश्चंस है, सो पहले क्वेश्चंस लीजिए.
तो एक क्वेश्चन है कि डॉक्टर दीप्ति ने पूछा है, which agad is useful in diabetic wound?
In diabetic ulcers, we can rely on Punaravartaka Jwarahara Kashaya interval at the initial phase if it is having in the slough and necrotic conditions are there, or in the neurogenic ulcers, we can think of Kottam Tagaradi Kashayam that we discussed, right? Yashti Madhu, Tagara, Kushta, Chandana, Ushira, and Sariva Yoga. There was a diabetic ulcer, multiple diabetic ulcers with 6 ulcers on his foot, on the sole of the foot, with the sugar level near to 400. So what we had done was, we had prepared a kalka of this yoga, and after cleaning the yoga with the kashaya of this Kottam Tagaradi, we had prepared a pad with the kalka of the same yoga and had put for bandaging, and for controlling the sugar, we had given Amukura Vayambadi Kashaya, Ashwagandha Vachadi Kashaya that I discussed in the presentation. We had tried with that. And Jiva Raksha Gutika, that we are preparing that Jiva Raksha Gutika. And I purchase, once the stock gets exhausted, I purchase from my Guruji. I have a Visha Chikitsa Guruji. He had taught me how to treat the cases of snake bites and all. I get it from Sir Jivaraksha Gutika. That was given for him for initial phase, 1 OD dose with the Kshira. Then after the wound was healed, we had dealt with in the line of Vataja Prameha, where Rasnadigrita is one of the choices. Rasnadigrita is a very good yoga where pain as well as Vata Vyadi gets managed. Dhanvantaragrita, of course, is a very good choice. Dhanvantaragrita is a very good choice in Vatika Pramehi, but we opted in him. So Kottam Tagaradi as well as Amukura Vayambadi will be a very good help. Thank you.
Thank you, sir. There are many questions from Dr. Suryanarayan Patnaik. One of that is, which Ayurveda dravyas are useful in and as Ashukari Vrishchika sting?
Pardon?
Vrishchika sting.
Vrishchika sting, right? It's a condition that we have to manage in the line of Vata predominant condition. So once the sting is there, first we have to think of one very common yoga is there in front of us. Bilwadi and Dashangam, of course, is there. Our drug of choices, first need is internal administration, Bilwadi Gutika and Dashangam Gutika. And that can be prescribed in a little bit different way, where we try that prescription as half tablet 4 times a day. Bilwadi half tablet 4 times a day or 6 times a day. Similarly, Dashangam Gutika also half tablet 6 times a day. And what we can use externally is, there is a drug called Viparita Lajjalu. Viparita Lajjalu. Bryophytum sensitivum. This Viparita Lajjalu mixed with the butter is very good for external application where pain can be managed together with swelling.
Thank you, sir. Second question, in Amavata, if any sting happened, is instant action or delayed appear?
I didn't understand. If in Amavata?
If any sting happens, I think he wanted to ask that in Amavata patient, if any sting happens, the action will be instant or delayed?
No, there is a reference in Charaka Sutrasthana 19th chapter while mentioning about Agantuja Vikara. In a case of Amavata, I think what the doctor who had asked question means, in a case of Amavata, if there is a sting condition, right, will the response be delayed or it will come abruptly? I think it has to be seen in the line of Agantuja condition itself. Even though Nijadosha is there, in every clinical condition and Agantuja Vikara, the symptoms will manifest spontaneously. I don't think there has been any change in that. If at all any experience is there, I would like to get a feedback from that doctor itself. I have not seen it.
Yes, Dr. Surya Narayan Patnaik. Another question is that paracetamol is a pitta prakopak dravya, which is our dravya in our system. I think he wanted to ask the substitute for paracetamol.
Dr. Sangeeta madam, Dr. Mahesh sir is there also, Dr. Joglekar sir is also there, Dr. Atul sir is there. So I request all the Agatantra specialists for their interaction with all these questions also. Dr. Mahesh sir, स्वागत है आपका. Namaskar sir. Dr. Joglekar sir.
Yes.
Namaste sir. You can also say or you can also answer the questions.
Dr. Joglekar sir, Dr. Ginode sir, and Dr. Mahesh sir, may I request you to put your views on questions. So our next question is from Kimaya Dhulifale.
May I clarify one thing?
Yes.
No, there was a question regarding doctor. The paracetamol is Pitta Prakopaka Dravya, which is our dravya in our system. See, here the concept of Jwara is very widespread actually. Very wide spread. Paracetamol is Pitta Prakopaka Dravya, which is our dravya. Pitta Prakopaka Dravya or the management of Jwara is a very big spectrum. If we see, there can be clinical condition which can come in front of us with the Jwara and Shwasa as an associated symptom, Kasa as an associated symptom, joint disorder as an associated symptom, and at the same time skin manifestation as an associated symptom. If we see Jwara Chikitsa, there are a few hints regarding what is to be done when a patient is coming in these pattern, Kasa with the Jwara, Shwasa with the Jwara. So it is condition specific and there cannot be a stereotyped prescription or a tailor-made prescription for such clinical condition. According to those presentations which come in front of us, we will be able to form a proper prescription. Even Bhallataka toxicity, for example, I would like to give one clinical example where Bhallataka toxicity is there. The patient develops rashes. Now, two cases two cases simultaneously, luckily or unlucky to the patient, lucky to the doctor. Luckily, two cases simultaneously had come, and for our children, for our students, we had two line of treatments where one patient had come with Jwara as a predominant feature together with the skin rash. First he developed Jwara, then skin rash. Second, he developed skin rashes as a result of secondary infection. He developed a fever. The management was entirely different. We cannot think of giving Vibhitaki for both the clinical condition. The medicines changes according to the presenting complaints as well as how the disease started. That's why I told there cannot be a tailor-made prescription. Thank you.
Thank you, sir. Again,
Dr.
one
Vikas, sir,
question.
please unmute yourself. Dr. Vikas. Yes, sir, please.
In
One more
Bhujangavisha,
question is there, sir. Yeah,
yes,
Dr.
in
Vikas.
Bhujangavisha, can we save the patient not going to venom injection?
Obviously, we can say. That's what I told. My teacher Manmathan Vaidyar, he is in a remote village in this district, Malappuram district. He has been practicing for the past 50 years without any antivenom, and cobra or bites and stings. We have a very reliable set of drugs. Without antivenom, we can manage.
Which agad is useful in allergic conditions like anorexia, Schwarz, etc. Dr. Kimaya is asking.
Vishavilvadi agada. Vishavilvadi is a very good choice. Definitely. Allergic and skin not shown in this because a few pictures of such photos are there. Urticaria together with the laryngeal spasm and the patient going to difficulty in respiration. This Bilvadi and Dashangam in a divided dose together with Madhu is a very good choice. Bilvadi with Dashangam. No external administration of any Kashaya or any Lepa is needed, or internal administration. These two medicines will be sufficient. Bilvadi as well as Dashangam together with the Karanja Patra Swarasa. And also in atopic dermatitis, Dr. Harun Kerala had suggested Sudarshana Ganavati, Gopi Chandanadi and Bilvadi. I use Gopi Chandanadi Butika with the Karanja Patra Swarasa in the first prescription in atopic dermatitis where fever is a predominant feature. That is a very good choice in the question which was asked now.
Again, one question from Ahirkar.
Okay.
Dr. Ahirkar.
Okay, doctor.
Yes, sir.
Yes, sir.
You stopped the antivenom injection. Just you stopped. Some dravyas are there you are stopped. Your guru told some dravyas. There you stopped. Please complete that one. In the Bhujangavisha, antivenom injection not required means our dravyas are there in Kerala forest. Some of the herbs or roots are using for instant recovery of the patient. Please express them.
Yes,
That's
sir.
secrecy of the medicine.
There is no secrecy in it because whatever the Visha practitioners practicing here, for example, Vaidya Brahmadattan is there, Vimala Madam is there, or Manmathan Vaidyar are there. They are all exponents in the bite and sting management. They manage without any antivenom with them. They are managing with all these medicines which we discussed. The whole Agada Yogas which we discussed today is an abridged edition what they have been practicing. Together with that, there are a few yogas which I have not discussed today because it will be a very long presentation and it's not a snake bite session, right? Jiva Raksha Gutika is one yoga. Taruna Bhaskara Gutika is one yoga, and Vishahari Leha is one yoga, and Garalagna Rasayana is one yoga, Hingwadi Gutika is one yoga. These are 5 yogas which they are practicing in addition to the presentation that I have made today. They use the same Vilvadi, Visha Vilvadi in the bites and sting cases. They use this Arkapatra Sweda. They use Kushmanda Kanda with the tender coconut water, or Kushmanda Kashaya with Ela. And Pippali, one question was asked, Pippali is Pitta Prakopada, is it good in? Yes, definitely. If it is used in a very small dose, 1 or half Pippali powdered as a Prakshepaka, not added in Kashaya form, that enhances the action of the drug. In that way, Pippali is essential in that condition. And for example, our whole Vishachikitsa is theoretically Vata Pitta Uttare Nranam Sadhyo Harati Jeevitam may be the textual reference, but in reality, the medicine that are used are very Tikshna in nature. For example, Jiva Raksha Gutika contains 8 or 9 toxic ingredients. Haratala, Manashila, and Vanga, Parada, all these are there. They are used in Shodhita or Ashodhita Avastha depending upon the magnitude of the case. So these are the yogas that they have been practicing in managing snake bite cases. Thank you.
Thank you, sir. Thank you. It was really interesting subject, interesting session. I think it's unique. So, Dr. Sangeeta ma'am. Now I request our chairman, Dr. Jogrekar sir, for his review.
Hello, am I audible?
Yes, sir.
Yes, sir. Continue.
It was a very nice exposition of traditional Kerala. I want to comment on a few points. First thing is Dr. Gopi Krishna mentioned about repurposing of drugs. How we can use our own formulations for different purposes. Say, for example, COVID. So, repurpose is an important area where our physicians should work and document it. One more thing I wanted to know is about Prayoga Samuchayam. I had heard that Kottakkal Ayurveda College is trying to bring out English translation of Prayoga Samuchayam. But I have not yet seen any publication which is English publication, English translation of Prayoga Samuchayam. That is the need of the hour, because once those yogas are available in English, people from other states can study those yogas, and utility will be increased much. So that is that's why I wanted to know about Prayoga Samuchayam. One yoga you mentioned, that is Parantyadi Tailam, and I have seen excellent results of this Parantyadi Yogam in Mandali Damsha. In patient where anti-snake venom was injected in the infected wound, the necrotic wound after Mandali Damsha, and there was absolutely no regression. But when Parantyadi Tailam was used, the wound cleared just like a magic. That is a very powerful yoga. Unfortunately, all the ingredients and everything is in Malayalam, so we don't understand what is being used. We only know that this is being used. This is the name of the yoga, and this is useful. But I would like to emphasize that Avidyata Aushadha is another name of a poison. So if we don't know about our Aushadha, we are using Visha. So it is always better to know maximum details about which drug we are using and what are the ingredients. For example, there is this Jiva Raksha Gutika. I think one of the ingredients is Kattu Chanakam, right? Right, Dr. Gopi Krishnan? In Jiva Raksha Gutika, one of the ingredients is Kattu Chanakam. Is my memory correct?
I think sir left the meeting.
Okay, no
Sorry.
problem. Dr. Mahesh
Yes,
can
yes.
also answer.
Yes,
Mr.
sir,
Mahesh,
it is
sir.
there. Yes, sir, it is there.
Yeah. Now, Kattu Chanakam is something which has to be collected and stored at very precise times, and it is very difficult for non-Keralian person to understand how it is collected, how it is used, and that is an ingredient which I think refers to the microbiome of that bull. It is the meconium of bull, meconium of the calf, buffalo calf. Is it correct, Dr. Mahesh?
Sir, cows. Cows.
Cow calf.
Yes, sir, yes.
Yeah, it is buffalo calf. Okay. So we have to collect meconium at proper time and then use it. And I don't know whether various pharmacies do follow the ethical ways of preparing drugs, because there are many done by the pharmacies, and that's why I would advise against using online drugs. So with that, I close my remarks. Over to Sangeeta Deshmukh.
Thank you, sir. Thank you very much for your view. And I too do agree with you, sir. Our co-chairman, Dr. Ginode, sir, I request you to put the express your view on the lecture of Dr. Gopi Krishnan in few words, so that
Yes,
we
yes,
can
yes.
proceed to next lecture.
Yes, definitely, definitely. Actually, it is difficult to comment after chairman's remarks, but still, organizers asked me to add my comments. Actually, Dr. Gopi Krishna sir's presentation was very nice, and it was actually a confidence booster for the beginners, like who want to start their general practice and add agadas in their practice. So I congratulate Dr. Gopi Krishna sir, and I hand over the mic. I over to Dr. Sangeeta Deshmukh, madam. Thank you, madam.
Thank you, sir.
Yes.
Thank you. Every drug which is medicine can be the poison, and every poison can be the medicine, and the difference is only of intention and drug. So the lecture was very useful for general practitioners, and now I proceed with next session. Subject topic of our section is allergic skin manifestation, Agat Tantra approach. So I request Dr. Mahesh sir, BMS MD Agat Tantra, UG from KLE BMK Ayurved College, Belgavi, PG from VPSV Ayurved, Kottakkal, Kerala, working as associate professor in Department of Agat Tantra, BMK Ayurveda Mahavidyalaya, PG Studies and Research Centers, Belgavi, Karnataka. He has published 15 articles and now practicing as a Ayurveda dermatologist since 13 years based on Agad principles. So may I request Dr. Mahesh sir to continue this our next lecture.
Thank you, madam. Thank you, one and all, for giving me this opportunity. Can I share my slide? Whether my slide is visible, madam?
Yes, sir. Yes.
Okay.
Yes, sir.
At the outset, I thank all the organizers who gave me this opportunity to be in this important session for the celebration of National Ayurveda Day. So most of you might have attended my previous lectures. Most of the cases that I'll be discussing here are repeating because very recently I have given some 2-3 webinars, and I had no much time to segregate new patients, but still I will try to keep it interesting. Now, when it comes to allergy, let us take this case. A lady around some 65 years or maybe more than that came with a complaint of swelling and burning sensation of the face and entire scalp. And if you see here, there is continuous sweating is there. So she used this one type of Kali Mehndi, and because of that, she developed this one. So when we look into this case, what comes in our mind is what we need to focus on, whether we need to focus on our treatment or we need to give importance to the diet that is used for application, or the immunity, that is why that hypersensitivity is there, or only clinical presentation, or something else. So this is what we need to understand when we are approaching to any allergic manifestation. Most often people say like, I have solar allergy, I have allergy to milk, I have allergy to egg or something like that, protein allergy and all. Now, when it comes to the general layman understanding, we focus, and most of the times, even some of the physicians also consider it as the culprit is egg or the culprit is milk or sun or whatever it is. So there, if we change our understanding about what we need to consider as important, then we can treat these allergic manifestations very effectively. So starting with allergic manifestations, skin manifestations, how we can approach by using Agada principles in this. Now, it is one of the commonest presentation where everyone commonly look after etiology. But the problem is the etiology that a physician looks for is presumed etiology. It is assumed by that person as etiology. For example, a cosmetic has caused allergy means they consider cosmetic as the etiology. Actually, that may not be the truth. Okay. And these allergic manifestations, in some conditions, if they are associated with the profession, then they cause very miserable type of conditions to the patient. For example, if a mechanic is there and if he develops allergy to grease, a dhobi, or even a woman who do household works if they develop soap allergy, painter getting allergy to paints and all, these all make the life very miserable for those patients for which in parallel sciences, there is no right medicine. There are medications which are used until you use that medicine, that manifestation will not be there. But once you stop using the medicine, again, the clinical manifestation occurs. Or patient is asked to avoid the exposure. Think of these kind of professions where the profession to overcome the condition, if the patient has to, if the patient has to skip or the patient has to leave the profession, then how disturbing that condition will be for that patient in terms of financially as well as social and other things. So when it comes to understanding of disease manifestation, Acharya Charaka in fourth chapter, that is Prameha Nidana, Nidana Science explained very nicely. He says that Iha Kalu Nidana Dosha Duksha Visheshebhyo Vikara Vighata Bhava Abhava Priti Vishesha Bhavanti. Overall, a manifestation of disease is dependent on how these Nidana, Dosha and Dusha interact with that of the Vikara Vighata. Vikara Vighata is nothing but immunity. So Bhava means when that immunity is there, at that time the disease manifestation is different or disease may not manifest. Abhava, when that is immunity is less, at that time how the disease manifestation takes place. For example, for understanding that in Chakrapani comment, he says if immunity is good, that is tatra vikaranam vighata bhavasya prativisheshaha, means if vighata bhava is there, means it is there, it is good, then vikara jananam tata chirena jananam anuvikara jananam or asarvalinga vikara jananam va. That is, if the vikara vighata bhava is there, then this anubandha, that relation, that they do not interact, means vikara vighata or immunity overcomes those etiological exposures or that doshic condition. So there will be no manifestation of any disease. Or if it is slightly less, vikara vighata is there, but etiology is very strong, then kala prakarsha means over a period of time, when the exposure is continued over a period of time, then disease manifestation is same. Or when the etiology is very less and if immunity is also a little bit affected, then it may manifest disease, but the disease may be tanu, means it is not very severe compared to other conditions where same etiological exposure can cause a disease. Or ayatokta sarvalinga, that is, it will not be caused as a fully manifested disease. Chakrapani says that kala prakashat anubandho. Why? What is the meaning of kala prakashat anubandha? Means nidanasya doshena tada bhavati yada hetur vichedam krutva punah sevyet. Means frequent exposure, periodic exposures to the particular etiology will be there. At that time, this kala prakasha means delayed manifestation of disease is seen. Now, if immunity is not good, then immediately there will be paraspara anubandha. So immediate disease manifestation will be there. Shigra anubandha, so acute manifestation. Balavattam anubandha, that is strong association will take place and severe clinical manifestations are caused. Now, what is vikara vighata? Vikara vighata is nothing but oja or bala of the person. Now consider what are the hetus that affect this bala or oja. If we consider oja, vyapat and all, there krodha, shoka, virudahara, so many things are explained. But when we look into overall the basics of Ayurveda, there are two main etiological factors. The first one is Visha, the second one is Madhya, which are 100% opposite to that of Oja gunas, and that is why they affect Oja of an individual, thereby affecting the immunity of the individual. If we consider present day etiology, like through Ahara, Vihara, and Vichara, which are going to affect our Oja or immunity, like from the start of the day till we go to bed, we get exposed to one or other synthetic chemical or toxins or poisons, maybe in the form of like the toothpaste that we use that contains some chemicals, the tea, the food that we take contains additives, preservatives, and even there is biomagnification through that residual pesticides or residual fertilizers, or sometimes heavy metals due to increased industrialization, sometimes they gain entry into the food chain. Vihara, where we work, the environment where we work, most often these metros and all or sophisticated companies, the people work under AC. Again, that is going to harm our health, our immunity, or the environment where we stay, like due to automobile effluents or industrial effluents and all, we get exposed to n number of toxins, and which are, it's completely, more than 80% of people have a completely stressful life. So by all these, like through ahara, through vihara and vichara, our bala, that is our OJ, is getting affected every now and then. So that is going to affect the bala or the immunity of the individual. So when we consider all these things under the classification of Hetu, that is Nidana, that 4 types of classification. So Dushivisha and Garavisha, or low potent poisons that we get exposed, are to be considered as Sannikrishta Hetu. Viprakrishta Hetu are to be like Vishavardhaka Bhavas, that what we are considering like allergens can be considered as Viprakrishta Hetu, or they can be considered as Vabhichari Hetu also. Viprakrishta Hetu can be reduced bala of the person. Okay, so ultimately, what is the cause? Dushivisha toxins are the major causes that lead to clinical manifestation of some allergic condition. Now, what about the drugs? Drugs also going to harm the bala of the person, and they are also going to cause so many clinical manifestations as adverse drug reactions or hypersensitivity reactions. Acharya Sushruta has very nicely explained, and this is one of my very common favorite quotations. Many times I stress this with more stress. I explain this to all my UG students and PG students, and I tell them that what is the ultimate aim of BMS means it is learning Samyak Prayoga of Beshija. That is Tadeva Yuktam Beshij, Tadeva Yuktam Beshiyam Yadarogya Kalpade. Means if we learn that one, then we can say that we have successfully completed the BMS or even in India. So what Acharya Sushruta says, Sarvanyeva Aushadani Vyadi Agni Purusha Balani Abhisamiksha Vidya. Means any medicine, whether it is a Swarasa or it is any Basma, or though Basma preparations were not there at Samhita Kala, but whether it is a most safest or most toxic drug, everything administration of these drugs completely depend on how we analyze the Vyadhi Bala, Agni Bala and Purusha Bala of the person. So depending on that, if like something is there, like if we give a medicine which is more than the requirement of the disease, then that disease will subside. That is Vyadhim Tam Upashamya Vyadhim, Vyadhim Manyam Mahavati. It brings in another disease. Simple example, like if a person is having loose motions, and if we think that Putajaganavati may be effective, and if we give overdose of Putajaganavati, simple outcome will be the patient will land into constipation. Later 2-3 days, patient will not have passed stools at all. So like that, we need to assess those conditions, Agni Bala, along with Purusha Bala and Vyadhi Bala before administering any drug. So that is going to prevent any adverse outcome. So overall, what we see, there are toxins or poisons that we get exposed to them every day, and they primarily target our immune system. Okay, they create that Kavaiguna. That is why that Kavaiguna, what we study, Yatra Sangha, Kavaiguna, Vyadhi Tatlopajayate, that means these toxins are going to affect our immune system, and thereby, depending on the affinity of that toxin to particular system of our body or particular organ of the body, that Kavaiguna is created, and then these precipitating factors, which we treat as allergens, will manifest or will cause a clinical condition. Now, overall, what we can consider these things as, these are nothing but the basic cause of any allergy is reduced immunity or immune response is the outcome. Outcome allergy is caused due to adverse or abnormal or subnormal immune response. So this is caused due to Dushivisha. Now, this phrase holds very good for explaining allergic manifestation. But it says, Dushitam Deshakalana Divasapne Rabhishnasha, Yasma Dushete Datum, Tasma Dushivisham Smrudam. Means Dushivisha is there already in our body. When the patient who is already having Dushivisha in the body, when the patient gets exposed to different Desha, different Kala and all. Here it is, many times people interpret it as Dushta Desha, Dushta Kala and all. It's not Dushta Desha, Dushta Kala and all. It is normal Desha, normal Kala and all. Because if it is Desha, Dushta Desha, then all people who get exposed to that should suffer from that disease. That we learn from Janapada Dhamsniyata, where Acharya says Samanya Roga. Samanya means all. Suffering severity may be different, but disease will be common. But here it is normal desha. That is why people develop, like I have I have solar allergy, develop solar dermatitis. Means all the people who are working under sun will not develop that. Means that person is having some immune related deformity due to or some Dusha Visha condition inside the body. So that is why that person is getting that clinical manifestation. It can be food or anything like that. So in modern science also, it is we get a reference where it substantiates the concept of this Dushitam Deshakala and Divasupna revision. What it says, there is a mechanism called as reactivation of stored poisons. What happens when a poison is stored in our body? For example, like Dusha Visha is there in our body. With having that Dusha Visha, when a person get exposed to some other drugs or any other exogenous factors, that can be food, beverages, or even environmental exposures, they secrete some solvents in the body, and those solvents serve as the liberating agents of those accumulated poisons, and those liberated poisons bring in physiological changes that lands into a pathology like allergic manifestations. And it is very commonly seen with that of heavy metal, chronic heavy metal or cumulative heavy metal toxicity. So common allergic clinical conditions that we see in our clinical practice, mostly means I have put these things because I have seen these cases and I will be discussing on those cases. That is why I have listed this. Food related allergies, cosmetic related allergies, medication related allergies, occupation related allergies, and plant related allergies. So what should be the line of treatment? So though, for all allergic manifestations, allergic conditions, that Nidana Parivarjana is considered as very important. So Nidana Parivarjana is important, but which Nidana? Is it the one that is causing the outside exposure? For example, if milk is causing some allergic manifestation, is it to avoid milk or something else? So that is to be understood. That is the exposure to that agent which is bringing in that allergic environment inside the body. Milk is just a triggering factor, or egg is just a triggering factor. It is like Vichari or that type of Viprakrishna Hetu, that type. So time being, that is also to be avoided. But over a period of time, the patient is to be made to avoid those etiologies which are triggering his that immune system. So in management, we need to give Vishagna Aushadhis which are suitable for Dusha Visha and Gara Visha. In the market, we get Dusha Visha Gada, Bilvada Gada, Dashanga Gada, and Murvada Gada. So we commonly prescribe only those formulations which are available in market. And along with that, we need to give Shamana Aushadhis as per the dosha, or Shamana or Shodhana according to the dosha. And at the end or during the course of line of treatment only, we need to give some like Grita Prayoga or something like that, Rasayana Dravyas, which are going to improve the Voja of the patient. Now, this is a patient who, as per the patient's explanation, he developed these lesions as a result of some fish allergy. Means he had continuously taken fish for 3-4 days or so. Then he developed these manifestations. So this is a condition that is manifested as a result of fish allergy, that is food allergy. So the condition was completely Pitta dominant. So we considered it as Pitta Pradhana condition. So Patola Muladi Kashaya was given as Rechana was needed, Pitta Harana. So Patola Muladi 15 ml twice daily, morning and evening, it was given on empty stomach. Along with that, Dusha Vishari Agada, that is Gulika, it is available in market, 2 tablets thrice daily with honey after food, and Gudichari Kashaya was given after food. External application, Arpamara Taila was given by mixing with coconut oil. Then in second visit, Patola Muladi was stopped and it is replaced by Patola Katronine, because Patola Muladi can be given for 6 to 7 days or 8 days, 9 days maximum, or else it causes more Vata Prakopa. Then we gave Patola Katronine, Gudichari Kashaya, Dusha Vishari, and externally Surya oil was used. Later, maximum reduction was there in the clinical presentations. So as he is a resident of Goa, so he has to eat fish. Many times sometimes it's very difficult to avoid such food. So that is why we plan to prevent such occurrences in future. So Virechana was done by giving Snehapana with Tiktakrata, Abhyanga with Tela, Nalpam with Tela, and Shrutleha for Virechana. In follow, Guduchari Kashaya, Dusha Vishari Agada, and Eladi Tela was given. Here you can see this is after Virechana. This is the outcome. Still, patient is, I think, 2 years or 3 years back. before the COVID first wave 1 year. Means 3 years back, we treated the patient, and the patient is still in our communication. Means his friend. So he's not have developed any disease, any allergy, even though he is eating fish. This is another one of our student. He had food from outside hotel, and next day morning he started developing these type of presentations with severe itching on whole of the body, upper part of the body. He had this one. So again, Patolakatronyadi Kashaya, as itching was there, so it was treated as Pitta Kapha. So Pitta Kaphahara Kashaya, that is Patolakatronyadi, Dushivishari, and coconut oil was given for external application. This is on 3rd day of treatment. That itching is very less, and there is no erythema. Erythema is almost reduced. This is on 6th day, I think. Just this is in between, I think. This is on 6th day. You can see just in span of 6 days treatment, the student was completely normal. He got rid of all the clinical presentations, and there were even no scars at all. So coming back to this patient, as she was very old, and she developed these lesions as a result of that one particular Kali Mehendi. So we considered it as Dushivisha condition. So we gave Dushivishari Gulika 5 times, and Haridra Kanda 5 times along with Dushivishari. Okay. Next day, we asked the patient to come, but by next day afternoon, means maybe patient might have taken some 12 tablets or 12 or 14 tablets, 7 doses I think she had taken, and all the complaints were completely reduced. And patient's husband came to the hospital, and we asked him to why your wife has not come, and she was very shy to come, because when she was brought to the hospital on the first day, previous day, he was shouting at her that at this age, why you need this dye and all. So she was not ready to come to the hospital, but he came and told that all the complaints have reduced, and we asked them to continue the same medicine for 2 more days, and after that medicine will stop. There were no further clinical manifestations. Now this is a patient with Paduka-Visha. We consider it as Paduka-Visha, but it was exaggerated as a result of Parthenium exposure. Patient was a farmer, and he developed these manifestation as a footwear allergy. But as a farmer, he was walking it was necessary to walk in the field. So he, later exposure to Parthenium exaggerated the condition. This patient we actually admitted, and we gave Stanika Seka and all, Trifla and Lodresevadi, external application, Nalpamrita Tela was given. Then Argyavardhini, Bilwadiyagada, Punarnavasava and Dovasa was, then Patolakatronyadi Kashaya was given. It is for 10 days. Then after once the patient was discharged, at that time Kalyanaka Grita was given, as the condition was completely dried up, and patient was little bit anemic. So Kalyanaka Grita, Yeladi Taila and Argyavardhini was given. So this is the condition after 19 days, you can see. And in second follow, patient came for another 10 days. There Ayaskriti was added, because Ayaskriti helps for improving the Pandu as well as the Varna. It is good for removing the scars. And along with that, Laghu Sudsekar Rasa was given. This is after 32 days treatment, and we planned for Virechana, again to prevent such recurrence in future. So Kalyanaka Grita Snepon was done, and Virechana was done with Ruth Leha. And then follow-up medicine, same Ayaskriti, external Manjistari Taila was given. And after 53 days of treatment, you can see the patient was completely recovered from the condition, but the scars will take some time. They took some time to heal, but further we had no follow-up of the patient. Now this is a case. It was diagnosed as diarrheous disease. As per modern dermatology, they diagnosed it as diarrheous disease, but we consider it as a Dushivisha condition and Vata-Kapha Kushta. Here what happens, this patient develops these type of lesions, which are hard hyperpigmented lesions on the parts that get exposed to sun, only on solar exposed parts. Here you can see. Okay, so this is a diarrheous disease for histopathology. So we considered it as Dushivisha, and then Vata-Kapha Kushta. So Snepana was done with Kalyanaka Grita, Yelai Taila external application, and Virechana was done. after Virechana, in first like follow-up, Patolakatrvanadi, Guduchadi, Dushi Vishari, and Yeladi Failure were given. Then in second visit, Patolakatrvanadi continued. To that, we added Manjistadi Kada, that is in the Arista form from KLI pharmacy. Dushi Visharagada and Yeladi was continued. Third visit, we gave Shamana Sneha again. In the first, Shodhananga Sneha was given, now Shamana Sneha. Kalyanakagrita, Sarivadyaso, Dushi Vishari. External application, mixture of like Yeladi Thala and Manjistadi. Means if morning, if Yeladi is applied, evening Manjistadi like that. Alternatively, it was advised. This is after I think 8 months, maybe August we started and February of next year. So 6-7 months. Here you can see the condition is markedly reduced. Important is not these lesions. The important is he started going to college. He is going outside in the sun. He is wearing Bermuda. He is wearing banyan and all. He is moving freely under sun and he is not developing any clinical manifestations. These areas you can see. So, and there is another patient. This is a drug-induced condition. It was diagnosed as stress syndrome. The patient had visited Modern Hospital for the management of arthritis, and then she was given with analgesics and all. And as a result of allergy to that analgesic medication, she developed this one. And this was diagnosed as DRESS syndrome. DRESS syndrome is drug-induced eosinophilia with systemic manifestations. Okay, this is diagnosed as DRESS syndrome, that is secondary to NSAIDs with uncontrolled type 2 diabetes. Now, type 2 diabetes was again drug-induced because prior to the treatment, patient was non-diabetic. And then when she developed this one clinical manifestation, they started with higher doses of steroids. And that steroid landed into the patient, and because of that steroid, the patient landed into hyperglycemia. And then she simultaneously had acidosis, biopsy. See, this is very important. This is one of the things that we need to understand. Clinically, that is clinically when we evaluate, it is skin biopsy, it says erythroderma. That is, we need to understand. That is for selecting Shamana. Means erythroderma, erythema is more, so pitta dominant condition, pitta vata condition, clinically, when we say it, etiologically it is a DRESS syndrome. So our treatment should focus on these two. Okay, so we need to treat that etiology, which we consider as Visha or Dushi Visha, and then pathology or clinical manifestation, Shamana Aushadhi, selection of Shamana Aushadhi, Kashaya or whatever we are selecting, that should be based on clinical presentation. So Shamana Aushadhi was given based on erythroderma, that is clinical presentation, and Vishagna Aushadhi was given based on the DRESS syndrome, that is the etiology, drug-induced manifestation. And this had even, we consider it as Charmadala and treated. So starting as patient had fever and all, so we started with Jwara Chikitsa through that is Sannipata Pitta Pradhan Sannipata Jwara Rakashaya. This is Amrutottara Kashaya available in market, but we gave Churna for the patient to prepare the Kashaya and drink. Along with that, Bilwadi and Punarnava the Kashaya were given. And then we made some changes as per the requirement. Means once it was replaced by Patolakatrvanadi Kashaya, once Nimbadi Kashaya. In between, patient had some cough. So for that, Sitopaladi and Talisadi was given. So depending on the clinical presentations, we changed them. But overall, Patolakatrvanadi Kashaya, then Punarnavadi Kashaya, Nimbadi Kashaya, Dushi Vishari, Bilwadi, and for Kasa, that Sitopaladi, Talisadi, along with Deshmula Katotrayadi Kashaya were given. And as sugar level were high, so later as the clinical conditions reduced, we switched to Asanadi Kashaya and that of that is Nishamaliki, that is from KLI pharmacy, we use that one. So we started that, and this is what you can see after the treatment. We treated the patient for I think 4 months or 5 months, and we were able to give a very successful outcome to the patient. Here you can see this is completely reduced, condition is completely reduced. Oh, okay, sorry, they are repeating. This is another patient. He is a farmer by profession, means he works in the field, and as per her explanation, she developed this presentation as a result of some plant allergy, exposure to some plants in the field, and there was severe itching and mild sticky kind of oozing, means Kapha Pradhana Pitta type of presentation. whole body, he had this problem. So we consider it as like Vichachika, Sigma scaling is there, Sigma, Vichachika as it is Kapha, like that. Kapha is dominant. So in this patient, again, Patola Katranadi, Bilwadi was given along with Amrutputra Kashaya, and Panchavalkala was given for Seka. In the beginning, external application was not given like oil and all. So Panchavalkala was given for Seka, that is, Seka should be done. So after the treatment, I think we followed this treatment for 2.5 months or so, maybe, and she was completely out of the suffering. That problem was completely reduced. Here is a kid around age, I forgot the age is some 12 or 13 years. She developed these lesions all of a sudden. And she was in Kolhapur when she developed this one. And then they consulted modern doctors and they diagnosed it as leukocytoplastic vasculitis as a result of some allergy, hypersensitivity reaction. And the treatment was steroid and antibiotics and analgesics were given in this patient. So it is hypersensitivity vasculitis. So here, what was important is the cause. They treated it as hypersensitivity reaction and steroid therapy was given, but there was no any change at all. Even in presence of steroids, the complaints were increasing. So here we took proper history, and history revealed that she developed these manifestations, means prior to the previous day to the manifestation of these presentations, she was playing outside, means in the maybe in the vicinity, nearby vicinity of the house. So there she somehow stepped accidentally on the anthill and she got bitten by multiple ants, small red ants on her legs. And as we all know that kids will be very much engaged with their sports, she neglected. And gradually next day evening, I think by next day evening or 2-3 days, she started developing reddish papules, and then they considered consulted modern dermatologist. And we consider it as Pittaja Kitavisha, and we treated accordingly. So again, Patola Katranadi Kashaya, Bilwadegada, Dushisharagada, Nalpamaradi was given for external application. So as patient was on steroid, so we asked the patient to reduce that steroid by tapering. So as the tapering was started, patients started to get new lesions. The lesions started increasing, but we persisted with the treatment and we asked the patient, convinced the patient's parents to continue with the treatment. And later, she had some pain abdomen and all, which is very common in this leukocytoplastic vasculitis. So we gave Ingvastat Churna with Vikrita, and externally Nalpamaradi was replaced by Manjistazide. And here you can see no steroids since 7 days, only Ayurvedic medicine 7 days. So Patola Katranadi was stopped, continued Bilwadegada and Dushisharagada, and Nalpamaradi was reintroduced. As in between we added Manjistazide. 4th November only Dushisharagada and Nalpamaradi. Mid of November only Nalpamaradi, no Dushisharagada. 22nd January, no medicines at all. And this is March 29, no medicines, nothing. Why this much of follow-up is done? Because this is the condition where recurrence is very high. Recurrence rate is very high. Within span of week, 10 days, months, recurrence is there. So that is why we followed. And we asked the patient to send periodic photographs, and patient used to send through WhatsApp. We are very thankful to the patient. Here you can see a similar kind of treatment used for allergic footwear dermatitis. This is a doctor, surgeon, ophthalmic surgeon. He developed this presentation. We can clinically it is palmar psoriasis as a result of glow allergy. And we treated this using Dushisharagada line of treatment. Now this is a lady from Tamil Nadu. She developed these white patches as a result of dye allergy, hair dye allergy. And she was treated with so many medicines for 4 or 5 months, and she was not getting any result. And then somehow she was referred to us. But after this day, we lost the follow-up. She didn't return for the treatment. Now here, what was done is Asanadi Kashaya as that of Shitra Chikitsa. Asanadi Kashaya, Punarnamandur, which we commonly use, along with Nalpamaradi Taila as Varnya. It improves us like from hypo to normal, from hypo to normopigmentation. Nalpamaradi is very good. So we use Nalpamaradi Taila for external application. Here you can see 6/9/17 we started the treatment. 11/10 means after 1 month or maybe 34 or 40 days, you can see there is marked reduction of the clinical presentation. This was the condition first, and here you can see this was the presentation. Okay, here you can see the same Shitra Chikitsa, but addition of Dushi Vishari Agada as the etiology was dye allergy. This is another case, diabetic patient, but developed this as a result of wristwatch allergy. Here also Asanadi Kashaya, Dushi Vishari Agada and Punarna Mandor was given, and externally Nalpamrita was given. Usually, why these medicines repeat in every patient? Because in our teaching, as we are in a teaching hospital, I make sure that students should learn, outcome. They should develop confidence. So when we prescribe same medicines whenever required, in right condition, similar medications, when we get positive outcome, students will develop a kind of confidence. Yes, that is what in research reproducibility means. Whenever you give such condition is coming, whenever you give similar kind of medicines, if outcome is good, similar outcome if we are getting, then we can substantiate what we are doing. So because of that purpose, we follow some strict, same regimen for most of these cases. This is a girl when she came to us, I think 21 or 18, I think 18 maybe 18 or so. She started developing these lesions. It was diagnosed as erythema indolens centrifuga as a result of allergy to penicillin when she was at the age of 8 years back. 20 means at the age of 12 or 13 or around 10 or 12, she developed these as a result of penicillin allergy, and she was frequently getting it. Whenever she gets exposed to cold or dust or even colors of foliage and all, she used to develop these things. And even she had history of developing these lesions on taking any paracetamol preparations, paracetamol containing preparations. So this patient, Dushi Visharagada, Potolomuladi Kashaya, we wanted Virechana, but patient was not ready to take Snepan. So this Potolomuladi Dushi Vishari formulation, this was given for longer period, 2-3 months I think we gave, and then we managed a pattern like first 15 days we gave, then we stopped, then a week break was given, then again given, like that we did for 2.5 to 3 months, and patient later developed a completely, she got rid of that manifestation, and even after exposure to cold and all previously allergic manifestation allergens, she was not getting any further clinical presentation. He's a farmer by profession, so he developed this as pollen allergy to that Parthenium exposure. And in this patient, again, we consider that it as Dushivisha, Potolocatroinati, Dushivishari, Nalpam, because it was Kapha Pittaja condition. So Potolocatroinati, Dushivishari as it is Dushivisha, and Nalpam for external application. Second visit, so here you can see the Pitta association has reduced a little bit. So Kapha is also reduced. So itching was the dominant presentation. So Nimbadi is good for reducing itching. So Potolocatroinati was replaced by Nimbadi Kashaya. Nalpamradi was replaced by Eladi because Pitta has reduced and more of water is there. So Nalpamradi replaced by Eladi. Third visit, Dushi Visharagada and Eladi Telugu MD continue. And here you can see the outcome. Sorry, that photograph is not so clear. So I think 3 follow-ups. Patient was completely normal, but this discoloration takes more time to come to normalcy. This one I will move fast. This is a case. He was RMP means he was a compounder, then learned medicine, and he started practicing. He developed these lesions as a result of self-medication. He had some problems. For that, he took some medicines and he developed this one. This was diagnosed as erythema multiforme, a very severe condition. The patient was treated in a reputed modern hospital for 4 or 5 months, and there was no result at all. Along with these clinical presentations, he developed a hidradenitis suppurativa that we can consider as Taksha. So this patient, we tried all our attempts to give Virechana was failed. He was chronic smoker and completely daily used to have non-veg and all. Even on admission, his appetite was very odd. When if at all we feel that appetite is good, and if we started Snepan, next day he used to develop fever like that. Means Agnimanjya was very severe. So all the 3 attempts of Snepan at 3 different admissions failed. So we managed this patient successfully only by Shamana, internal and external Shamana therapy. 7 months we treated this patient, and after that he was completely all right. In between he developed his hidradenitis suppurativa. When all the complaints were reduced, heat radiative suppurative, that Kaksha got aggravated because once again he started smoking as usually he used to smoke earlier, and he started eating non-veg every day, and again he developed that one. Then again that was also managed very successfully. Here you can see this is the outcome of the patient. Fast. Okay, so this is, I think I came to the end. So if at all such allergies are prone, for example, in future, for example, when a person is moving from one place to another place, when that person is going to expose to newer things, chances of allergy, developing allergy is there. Then for my knowledge, for my understanding, the line of treatment that is explained for Virudahara is very maybe fruitful. There it is said Virudahara Roga, it is said Shuddhiratreshta Shamova Tad Virodhi, means you can do Shodhana or Shamana depending on the clinical presentation. But to prevent, even on exposure to Virudahara, to prevent the clinical manifestation of any disease, their Acharya says, similar is seen in Charaka Samhita also, that is Dravya Staireva Purvam Sharirasya Abhisamskriti. Means if at all I am going to expose to such foods which are going to cause pitta prakopa in me in future after 15 days or a month, so prior to exposure to that, my body should be treated or processed, that is samskriti, is to be done with those drugs which are going to prevent pitta prakopa. Okay, for example, if I am going to expose to vata increasing conditions, so now only before the exposure, I should do brahmana, I should give like snehana and all to my body, I should treat my body, and then if I get exposed to that etiology, then that etiology will not harm me or harm the patient to that extent which is predicted. So to prevent any future forthcoming or in future getting exposed to any allergies, so in such conditions this second line of approach holds good. So to conclude, in allergic conditions, give more importance to internal pathology than allergy. See, we can say that we have successfully treated any allergic patient means if you re-challenge the allergen and if patient is not developing any allergic clinical manifestation, then you can say that you have successfully treated. Asking the patient to avoid the allergen, exposure to allergen and giving medicines, and the patient is free from the clinical manifestation is not a right line of treatment. So Ayurveda, as per our science, there should not be recurrence of the disease. So we have challenged many these urticaria patients wherein the allergen was patient was exposed to allergen again, and there were no other there were no further manifestation of any urticaria. So in all allergic skin manifestations, treat for Dushivisha along with dosha specific Shamana yogas, as I told as example in that DRESS syndrome. So DRESS syndrome is caused due to drug allergy, NSAID allergy, so that is Dushivisha. So you treat for that with the Vishagna Aushadhi. Erythroderma, pitta dominant kapha condition. So for that you do Shamana Aushadhi. So like that we need to select the Shamana Aushadhis. A small intro. This is recently I have started my YouTube channel, Dr. Mahesh Speaking. So wherein I'll be periodically uploading videos about skin diseases and Agara Tantra and basic principles of Ayurveda. So if any of you are interested, please subscribe to my channel and also ask your students. It will be helpful for them also. Okay, so thank you very much.
Thank you, sir. Thanks, sir. Thank you very much for explaining all the allergies in the way that there are, I think, no questions. It means that all is clear to the audience. So now I request Dr. Vishnu sir. Sir, any disturbance? कोणाचं तरी ऑडिओ स्टार्ट आहे का मॅडम? आवाज येतोय. So there is one question. What are limitations of Agad medicines?
Limitations as such. Am I audible, ma'am?
Yes, yes,
Huh.
yes, sir.
As such, there are no limitations until unless we make any mistake in assessing the clinical condition. So as the agadas that we use only those agadas which are nirvisha agadas, which do not contain any visha. And simultaneously, we use the agadas which are very saumya in nature. The most tikshna agada that we use is dashanga agada. Because
I would
we
like
only
to
use those agadas which are
expand
there
on
in
that.
market. Hello?
See, every
Yes.
medicine has its
Hello? Am I audible?
Sir is not audible, I think. Jogekar sir
Am I
is not
audible,
audible.
sir?
You were not audible, sir. Dr. Atul, sir,
Yes,
please
yes.
proceed.
Yes. Actually, I want to talk on some other point. While discussing the etiological factors, yes, sir. Yes. Jogekar sir is audible now. Yes, sir.
Yes,
Sir,
to
please
unmute.
continue.
Yes.
there was some problem with connectivity. I'm sorry for that. So as I was saying, every medicine has its own limitations, and that cannot be denied. Even if we say that this can be used in almost any condition, there are always limitations. We have to be very much aware of it. In a lecture given a few days back, I had told this about Gruta. In our text, we say that Sarveshu Sarvavastheshu Kevalam Grutopamam. So, in each and every poisoning case, should we use Gruta? There are limitations that fat soluble poisons will get enhanced with application or use of Gruta. So for every agada, there is definitely a limitation. But the thing is, we know the limitations only when we use them
Judiciously. Yes, we use them judiciously.
extensively. And it's not possible in we should do the animal experiments or cell line experiments or even in silico experiments to know these limitations. We should not blindly deny that there are no limitations. That should not be our attitude, and we should be aware that every medication does have limitations, but those limitations get exposed only on experimentation or vast experience. So is that question covered? Should I
Yes, sir.
do the concluding remarks? Or are
There is
there any
again one question, sir. Yes, there is again one question from Dr. Archana. In allergic rhinitis and allergic cough, is there any role of Dushivisha?
So I think for any allergy, whether it is respiratory or any other, so allergy is manifested as a result of disturbed immunity. As that is what I think I tried to convince, address. So that allergy we need to treat means it's depending on if it is productive, you give something like that. Shwasagna, Kasagna, you can select, but we need to treat, that's what I was telling, we need to treat Vishagna. We need to administer Vishagna drugs. So we commonly, though I do not practice like other than dermatology. So, but whenever anybody develops in my vicinity, my friends or somebody like patients, attender and all. So if they ask, I recommend usually Haridra Khanda along with this Dushi Visharyagada if it is productive. Otherwise, depending on, like if it is Vata dominant, Dushi Visharyagada will be given 100%. And along with that, like if it is Vata dominant, Dashimula Katute Kashaya, depending on that, as per the condition we can give. But Dushi Visharyagada is very effective. Here we need to think of not immediate outcome, we need to think of prevention of recurrence. So Dushi Visharyagada plays very important role in prevention of recurrence of such conditions.
Sir, Dr. Gautam has presented one case.
Yes.
13 years old boy developed sphincter over face near nose since last 7 days. He too patient had taken milk plus banana. Patient's pitta kapha prakriti. Please get some trouble to let me know what would be the treatment protocol.
Now, first of all, without seeing the patient, no, first of all, without seeing the patient, I cannot tell the exact medicine, but principles I can tell. As 13 years old, today only we had third visit of same 9-year-old boy having leukoderma. I think 1.5 months, today was the third follow-up. So 70% or 60% pigmentation has improved. There, what we gave, etiology was unknown. So Asanadi Kashaya was given along with this Navayas Aloha internally and externally Nalpamrite. But here, as the patient is having history of Purudahara and all, so acute manifestation is there. So acute manifestation means we need to give, Agadas very effective. They are very effective. So you can use Dushi Visharyagada along with Asanadi Kashaya or Bringaraj also I use. It's very effective in management of this Shvitra. But in pediatric cases, Bringaraj also may become a little bit more Tikshna. So Asanadi Kashaya you can use. Or anything which you feel is good for that condition. With that, you add Dushi Visharyagada. Then you can get better outcome.
Thank you, sir. Here, I dare to ask one question to Dr. Vishnu Joglekar, sir. Sir, we have one point in the syllabus of traditional medicine, but that point is not included in textbooks. So as Agad faculty is here, why don't we include the topic of traditional medicine in our textbooks? As we have the questions on it, long questions in PG exams and all, traditional medicines questions. Sir, are you getting my question?
Dr. Joglekar, sir.
Dr. Joglekar, sir.
Hello. Yes, you want to know why this traditional medicine is included in
syllabus.
Syllabus and what should be done about
but
that?
We don't get. Yes, yes.
So I get your question. The problem is syllabus was formed in 1970s or so, where it was just jumbling. Many people came together and just decided that this should be done, that should be done, this should be included, that should be included. There was that was the first syllabus prepared for Ayurveda during those period of 70s. It was dominated by old-fashioned thinking and how are going to deliver it was a question left for imagination of teachers. But with the new development of National Commission of ISM, this thing is going to change. As we have witnessed in that induction curriculum during last year, that was a very nice way to introduce Ayurveda to Ayurvedic students. And it was a well thought out program which gave proper orientation. When we were students, it was poor condition. I was one lecture per day to and learn our Ayurveda. That kind of thing, workshops regarding this. But in every workshop, what I find is people are ready to include new topics, but they are very reluctant to remove old topics. And every workshop ends in just additions to whatever is there in the syllabus. And this is a sad situation. But fortunately, with this National Commission on ISM, Dr. P.S. Prasad is the chairman of that curriculum committee. We are going to convey our concerns to him, and things are great. If there is something in the syllabus, it should have some application in the world. Somehow it should be beneficial to the student. See, what is in the history is important for motivation. See, in National Defense Academy, there is one large hall called as motivational room. And in that motivational room, all the big achievements of NDA pass outs are displayed very nicely. So with our rich history, our students get motivated. And that is the real purpose of having history, part of history in our syllabi. But asking questions about that for a few marks is rather misuse of power by the examiners. Means they are not going to give any answers, but they are asking the questions to the students just to gauge the or harass the student, and that is wrong. That is what I feel. Means it should be reassigned as some sort of assignment or some sort of report in the journal, just like our court visits or toxicology laboratory visit. In that way, there should be some assignment regarding in that classical part, and that there it should end. But all these things take much time to happen. In my experience, every single change requires at least 10 years to get implemented. So I hope now with the new commission, new mandate, there are going to be changes, and I'm hopeful that those changes will be student centered instead of being teacher centered. So, should I conclude now or continue?
Thank you, sir. Thank you. Thank you very
So I
much.
think time is, we are running out of time. So
Yes.
we are at the end of the session.
There are
Yes, yes, yes.
so, ज्ञानना उपजे गुरु बिना बिन गुरु भक्ति ना होय. ज्ञानना उपजे गुरु बिना बिन गुरु भक्ति ना होय. मन संशय ना मिटे बिन गुरु मुक्ति ना होय. That's why I asked you question, Vishnu sir. I dare to ask you that question. So, Shilpa ma'am, do we have next lecture or we have to conclude now?
Conclude. Yeah.
Yes. So, thank you all. Thank you, Ayush Darpan, for giving me opportunity to be a part of this session. And for Thanksgiving, I give this to Shilpa ma'am. Proceed to Shilpa ma'am.
डॉक्टर अतुल सर का हो गया है क्या रिमार्क?
View of
Atul
Dr. Atul sir.
यस यस सर छोड़ेंगे नहीं, आपको रिमार्क तो देना पड़ेगा.
नहीं एक्चुअली यस आई एम वेटिंग फॉर दैट कि डॉक्टर जोगेकर सर के रिमार्क बाकी थे.
हाँ
Yes,
ठीक है,
okay.
हाँ ठीक है, इट्स ओके. या जोगेकर सर प्लीज.
नहीं सर मैडम एक्चुअली एज पर प्रोटोकॉल इट इज it is difficult for me to add my comments after chairman's remark. So I will add just few sentences and then I am eager to ask sir's comments also.
Okay.
I think
Yes.
according to protocol, Dr. Ginode should have his comments first, and then I conclude according to whatever time is remaining.
Yes, sir. Yes, I will not take much time. I know we are already running very short for time. So just I want to add one point that while discussing the etiological factors, Mahesh sir said that 80% people have stress. But I would like to add that in this digital era, almost 99% people are having stress or facing stress. So with this causative factor, the prevalence of the diseases of sarvavyapi organ, that is skin, is very much increased now in this era or in this period. So Mahesh sir already discussed these cases related to allergic skin diseases from childhood to old age persons. The Mahesh sir's inputs are actually really very insightful and very informative and evidence based. I would like to congratulate both the speakers. Both the speakers are very Shruta Karma, Drushta Karma, Kruta Karma, and Vyakta Karma. With this, I congratulate the organizers for creating such a knowledgeable feast and express my sense of gratitude for giving me this opportunity to be a part of today's deliberation. And it was very difficult for me to deputy the Honorable Chairman, Professor Dr. Jogekar sir, who happens to be my guru. Once again, I would like to thank all, and over to you, Dr. Sangeeta Madam.
Thank you, sir. Thank you. I think the lecture is running out of time, so I hand over to Dr. Shilpa ma'am for Thanksgiving.
Sir, Chairman sir's comment is pending, madam.
Okay, sir. Sorry, sir. So we are very eager to hear your view about all these two lectures and all Agartanta departments, which problems we face nowadays, and all about these lectures. Proceed, sir.
Yes. Yeah. Dr. Mahesh presented very nice cases, but what I liked about this lecture was his explanation about bhava, abhava, section early in the lecture. That is usually not covered in many of the classes in colleges, and that's why I appreciate his commenting on that. This kind of webinars should be held more frequently, so that more and more students get well oriented towards practical use of Ayurveda. So with this, I conclude the session and hand over the mic to Dr. Deshmukh.
Thank you, sir. Thank you very much. Dr. Shilpa ma'am, are you there?
Yes.
Yes.
So thank you very much all the speakers, viewers और सभी दर्शकों के बिना तो इस प्रोग्राम में रौनक नहीं आती और आज काफी संख्या में about 86 participants are there, so it's a great success I think, and people are asking about the link and all, and it was really interesting. So many messages I received about the session, and both the speakers are really good. So I thank you once again Dr. Mahesh sir, Dr. Gopi Krishnan for a wonderful presentation. जैसे कि अगत तंत्र के वेबिनार्स काफी कम होते हैं एज पर माय ऑब्जर्वेशन, तो ये भी एक था कि अगत तंत्र का कुछ ना कुछ तो किया जाए. जैसे संगीता मैम इज इन आवर टीम, Dr. Atul sir is there, Dr. Zoglekar sir is there as a senior faculty member from Maharashtra. So it was really a great pleasure to organize such a nice webinar. So thank you very much all, Dr. Zoglekar sir, Dr. Atul sir, Dr. Sangeeta ma'am for your wonderful coordination and moderator. So I think we are at the end. Thank you all the viewers also and all the Vaidyas who are present and enthusiastically asking questions. So thank you, and sorry for just due to technical issue we started somehow late. Actually it was really nice. So thank you. Namaskar sabhi ko. Namaskar sir.
Thank you.
Thank you, sir. Thank you, one and all.